Mr. Speaker, many people are suffering in rural areas. Because many county governments invested in dispensaries and health centers without providing medicine, without providing personnel. It is time the ministry order county governments and governors to stop further building of dispensaries and hospitals without equipping the first ones, without ensuring that there is personnel in the first ones. To ensure that there are experienced and qualified people on the ground so that we reduce the number of referral cases that are going to our referral hospitals like MTRH, Kenyatta Hospital, and other referral hospitals in our county government, in the headquarters of the county governments. This is the only way we can, actually, this is the only house that can put order in the health care so that we stop the cartels, we stop the corruption.
Member for Kamukunji.
Thank you, Mr. Speaker, for the opportunity to contribute to this particular bill. I would like to say that I oppose it on the following grounds, because we have a total failure of successive governments in Kenya to provide health services to the Kenyan public. And as a result of that, our health services are not adequate, they're not affordable, and they're not of the quality that is required to deal with the challenges of health that we have in our country. Kenyans daily struggle with the poor medical services and facilities, exorbitant medical charges and costs. And that is the problem that is sending thousands of Kenyans to their early deaths. And I think that is the crisis that we have. And this particular amendment is just an indictment of the terrible health conditions and medical healthcare medical situation in our country. And this is a well-meaning amendment from our honorable member, Didymus Baraza. But it is a problem that you cannot sort by legislation. A knee-jerk reaction to a deeper ailment that is afflicting our health services, a deeper malaise that is paralyzing our health services. And I think to a certain extent, some of the things that he suggests here could be done by the Ministry of Health. Create regulations, for example, policy regulations for internal referrals. They can do that without a legislation. We can't legislate everything. But I'm surprised that he includes external referrals. And I wonder under what legislation, under what international agreement that we as a government can do to regulate referrals outside our country. I have already said that, in fact, the first problem is inadequate healthcare infrastructure. That is what we should emphasize as legislators, to provide more money so that more Kenyans can have access to basic health facilities, hospitals, clinics, and medical facilities. Insufficient funding, we need to increase our funding. And also, we also need to address the shortage of health workers, doctors, nurses, midwives. According to the World Health Organization, Kenya only provides half, or even less than half, of the required medical personnel and medical practitioners in our health service nationally. That's another issue that this House can address by providing more funding. I will also say that by passing this amendment, we're going to create a new layer of bureaucracy, another layer of corruption, which would create a cumbersome process which would slow down and cripple the normal work of medical practitioners, which then can lead to delays, bottlenecks that can make life even more difficult for the patient and their families. The bureaucracy that we are trying to put into place by making this amendment will put lives at risk and lead to the unnecessary death of many patients. And therefore, I think we should reconsider, because this particular amendment is trying to address an issue that requires a much more stronger intervention in improving our health services, in putting more money into our health services, but creating another a bureaucratic layer is only going to make it more difficult in a situation of life and death. When you're taking a patient to hospital, a dear one, a loved person, you want he or her to get the best treatment that they can get. And because the public health facilities cannot cope with it, this is why we have a lot of private practices in this country. And to a certain extent in Kenya, because of misguided policies, almost all the good health services have been privatized. Ordinary poor people, rural people, the urban poor, cannot access health facilities. They cannot afford the cost of private medicine. And I think maybe this amendment discussion here in the House also provides us with an opportunity to rethink what kind of health services we want. Even the most advanced countries in the world have public health services that are affordable, in fact free in some situations. The British National Health Service, all the European unions have a heavily subsidized public services of good quality. And we're a developing country with a large number of very poor people. And if we cannot improve and finance and improve our health services, then many, many poor people are likely to die of diseases that can be prevented or cured. And that's why I think this amendment should jolt our minds to make sure that, in fact, we go and look at alternative ways other than regulating. You know, some of the problems that are raised by it can be cured through internal mechanism. You know, our Kenyan medical services have professionals, they have professional institutions,